prospective randomized trial of donor milk versus preterm formula. The primary outcome is seen here, and I quote, among very low birth weight infants, use of supplemented donor milk compared with formula did not improve neurodevelopment at 18 months corrected age. If donor milk is used in settings with high provision of mother's milk, this outcome should not be considered the treatment goal. In secondary outcomes, donor milk-fed babies compared to formula-fed babies showed statistically significant and highly clinically relevant 10.6 lower language and motor development receiving pasteurized donor milk supplements compared to formula. However, fewer infants in the donor milk group had necrotizing enterocolitis stage 2 or greater than the formula group. But there was no evidence of a difference in surgical NEC. Now, I could talk for a couple of hours about this, but I can tell you that stage 2 necrotizing enterocolitis, the radiologic diagnosis of necrotizing enterocolitis, is a mess. When you ask different radiologists to look at the same x-ray, there's something called a kappa value. If they all agree the kappa value is 1. A recent study that I've been involved with 2,200 babies showed a kappa value of 0.38. So if you're going to use radiologic necrotizing enterocolitis as a outcome measure, I think that's just a total mess, and I would not recommend doing that, not anymore. So these studies that we have of donor milk decreasing necrotizing enterocolitis should be taken with some skepticism. Now here's some other studies. I'm sure many of you have heard of prolactin. Okay, this is a human milk fortifier, and this is now commonly used in many babies. And the story in our neonatal intensive care unit was we had two groups, support groups. One is a nutrition support group, the other is a tiny baby support group. 5 years ago, we looked at the evidence in the nutrition support group, and we did not think that there was enough evidence to begin using prolactin. But the tiny baby support group felt that it was that we should probably start using it. So tiny baby support group won that argument, and we started using it in our neonatal ICU at the University of Florida. Saw no real difference in the development of NEC. And then these two studies came out. One study from Canada, Debbie O'Connor's study, and the other study was from Judson. And both of these studies showed no improvement in morbidity, mortality, or feeding tolerance with the human milk fortifier. We took that very seriously, and we stopped using the prolactin in our neonatal ICU about 1.5 years ago, and it is saving us $500,000 a year not using prolactin. Association of enteral feed type with neurodevelopment and